Hey there, grade 11s. Thanks for joining me with lesson 8 on blood compatibility. In this lesson, we'll be talking about what happens when different blood types are mixed, what blood types are compatible for transfusion, and then when blood is donated, what is it used for? All right. So the presence of antibodies in plasma creates danger if blood of an incompatible type enters the body. The antibodies will bind to the antigens, causing clots to form. So you can see in this image to the left, there's these little antigens on the outside of these red blood cells, and then these green little antibodies are going to end up binding to them. So it's going to cause these small clots to form, and this type of clotting is called agglutination. And agglutination will affect blood flow in smaller capillaries. They're very tiny clots. You can kind of see the blood clotting down here. But when it comes down to the capillaries, those guys are, essentially one cell thick. So when you have a clot passing through, it can be very harmful to the body. Agglutination also wrong transfusion also activates hemolysis, which is when the body begins to destroy red blood cells. And when the body begins to destroy red blood cells, it is a type of anemia. So it's going to essentially drop the red blood cell count. And a person who's receiving a transfusion is probably receiving it because they're in need. So if the transfusion goes wrong, it can be devastating to them. Okay. So when receiving or donating blood, your blood type must be known. So that's going to be your ABO group. So whether your blood type A, B, AB, or O, and your RH factor also must be known. If you see in this image down here, there's a collection of donations of blood, and if your eyes are good, you can see here that this says O positive. So they always want to know whether it's positive or negative. Persons with blood type O are called the universal donors because their blood is compatible in the bodies of persons with blood type AB, A, B, and O. It's because blood type O doesn't have any of those antigens on the outside, unless of course it's O positive, then it'll have the RH factor on the outside. But there won't be antibodies present in the plasma of these persons to kind of fight this blood type O. Persons with blood type O can only receive blood from a type O person. If they were to receive blood from an A, B, or AB, the antigens, if you kind of recall from last lesson, there was that table that showed the antigens on the red blood cell and then the antibodies in the plasma. Type O had the anti-A and anti-B antibodies. So the blood will negatively react in the body of a person with blood type O. If you have blood type AB, you are considered the universal recipient because you can take blood from almost anybody. AB, A, B, and O. It's because persons with blood type AB, they don't have any of those antibodies in their plasma, so they can accept donations from persons of these ABO groups. However, a person with blood type AB can only give blood to a person with blood type AB. So if you have blood type AB and you want to donate blood, awesome, but your blood can only be used with someone of your blood type, because if you give your blood to someone with blood type A, yes, you have the A antigen antigens, but it's the B antigens that are going to react with the plasma of the person with blood type A and so forth. So if you're donating blood in your AB, your blood will still be needed, but it can only be given to someone with blood type AB. Persons with Rh positive can receive Rh positive and Rh negative, but if you are Rh negative, you can only receive blood from someone who's also Rh negative. The first transfusion might be okay, but in the future, your body will have developed those antibodies to fight off the Rh factor if you are negative. So we want to make sure that we know both the ABO group and the Rh factor are really important. So as you can see, as I mentioned before in this image here, we're concerned with not only the ABO group, but we also want to know the Rh factor, whether it is positive or negative. Okay, so Canadian Blood Services facilitate blood donations in Canada. And a blood donation will extract roughly 450 milliliters of blood from a person. If you think about a chocolate milk container with your lunch, kind of one of those half-liter containers, that's about how much blood that they take when you donate. And the average adult has about 5 liters of blood in their body. So it is taking enough that their donation is worth their time, but it won't have adverse effects on the person who is donating. When you are donating blood, you want to make sure you have a really good breakfast. You want to make sure you're drinking lots of fluid and you're well rested. Otherwise, you might get a little bit woozy. They always have lots of snacks at Canadian Blood Services if you just donated lots of juices and donuts and kind of sugary things to keep your blood sugar up. If you're over the age of 17, you're eligible to donate in Canada. So in some cases, the blood can be used directly from the transfusion. They'll take that blood and they will give it to someone else who's able to receive it. But sometimes blood can be separated. And when you separate it, essentially you're just prolonging the shelf life of the blood. So it'll just keep a little bit longer. I think plasma can keep up to about a year if it's stored properly. And this bag of yellow stuff over here, that is plasma, that 55% water. 55% of your blood is plasma. So when it's separated, red blood cells can be used to treat during emergencies, surgeries, and cancer treatments. It can also be used to help a person with anemia. If they want to boost their red blood cell count, they can get a red blood cell transfusion. Plasma can be given directly to a patient, or it can be processed to purify the antibodies or albumin. Sometimes donated blood is actually taken for research purposes. Well, if you've donated blood, you would like to see your blood go to save a life. Research certainly saves lives because they can find better uses for this blood. Plasma can also be given to patients experiencing shock or serious burns. It's a little bit complicated, but essentially when you're in these states, your capillaries are more likely to kind of leak or give up fluid. So by giving a patient experiencing one of these conditions plasma, it just kind of keeps that fluid in their blood. And platelets can also be extracted to help patients with cancers, including leukemia. So they really try to take apart the blood and try to give it to the most specific need possible. So they're pretty efficient about doing that. That essentially concludes lesson 8. It was a bit of a short one, but I just wanted to bring to your attention this compatibility table. So this table is just going to show you what blood types are compatible. So on the column here, you have the recipient. And in this row here, you have your donor. So if you have a recipient, you have a person with blood type B positive, and they need a transfusion. They can receive blood from, where's my cursor? They can receive blood from O negative, O positive. They can't receive from blood types A negative or A positive, but they can receive from blood types B negative, B positive, and they cannot receive from A negative, AB negative, or AB positive. And that's because these A antigens are present in these blood types here, and a person with blood type B is going to have those anti-A antigens in their plasma. So familiarize yourself with this table and how to use it. It's really important for your assignment. It's important for your quiz and your test, just because just knowing how to use it is important. What did I want to point out here? That persons that have positive Rh factors, they can receive from negative or positive. So if you go over here to let's go to the A positive. A positive can receive O negative, they can receive A negative. But if you flip it around, if you're A negative, you cannot receive that positive blood. It is technically incompatible. So thanks for your attention today. I was going to the assignment here, sorry. For assignment 8, I believe it's 7 questions. I want you to explain what is agglutination, what's happening with the antibodies and antigens. That's kind of what I'm looking for. And then there's blood compatibility questions. So pull up this table. It's in the notes as well. And go through the problems and use a table if you need, but try to think about if you wanted to further your thinking and be more comfortable with the material, I would use that table from lesson 7 that shows the antibodies in the plasma and antigens on the red blood cell, because if you understand that, you will be singing. You'll be doing great. So those are the questions for the last assignment. This is the last lesson of the circulation unit. So thank you so much for your hard work and attention over the last few weeks. Next time we'll have a new lesson is on Thursday. We're starting the immune system. So prepare for your quiz on Monday. You've got your test on Wednesday, and Tuesday's a day to get caught up on any outstanding assignments, or if you need to finish your review. So thanks for your attention today.